Good morning, everybody. On behalf of the Fight CRC team, I'd like to welcome you to our first formal meeting of our International Consortium Early Age Onset Global Work. So we're going to go ahead and get started this morning. I think we have about half of the attendees who had registered for today, where we're going to talk a little bit further about the background of the Early Age Onset Work Group, and then talk a little bit about the work that we're moving ahead in our structure. We wanted to share a bit more perspective about background than we did at our meeting just a month ago, where we featured a number of the research topics related to early age onset research and initiatives. So I'm very excited that Josh Dem and Jose Pereira are going to be joining us today, as well as Reese Garcia on behalf of the Fight CRC team. So we're going to go ahead. I know Zoom has a couple different filter features right now, and we're having people trickle in, but we're going to go ahead and get started today. So Reese, we'll go ahead and get started. Reese, do you want to just share a little bit of an AV background in terms of what people should expect and how to use Zoom quickly for anyone who's new?
Yes, absolutely. Thank you everyone for joining us. Like Andy mentioned, you can use the Q&A feature or the chat function to ask questions throughout, and we will be posting a link or two in the chat function, so keep your eye on that. You'll receive a notification. If you do have any questions you'd like to come off mute, you can share the select the raise hand function, and we can unmute it. Aside from that, I think we're all set to go.
All right, wonderful. We will have the rest of our panelists actually introduced during the time of their presentation today, but I do want to extend a special thanks to all of those who put in a lot of time and efforts into really thinking about a dedicated approach for early age onset research and public and medical interventions to really address the issue. So thank you so much. We'll go ahead and go to our next slide. I know that we had a chance, of course, to talk with many of folks about who Fight CRC is, but for those who are new, Fight Colorectal Cancer is a patient empowerment and advocacy organization located in the United States to provide balanced and objective information based on colon and rectal cancer treatment, policy, research, prevention, and treatment. So we're very excited about being able to, in addition to think about the United States initiatives about how we're growing globally, to help advocate for stronger research collaboration and better education about early age onset disease, and specifically for our purposes today also for prevention, and thinking about how do we build, again, larger collaborations throughout the globe to really look at the etiology, symptom management, and public health and medical interventions for patients. So we're really excited, and again, one of the champions and people that we've been working with is Dr. Jose Pereira, who's also been an international leader in the work. So we're very excited about moving our work throughout the United States as well as globally. So Fight CRC is a relentless, our team who are relentless champions of hope, focusing on funding promising high-impact research endeavors while equipping advocates to influence legislation and policy for the collective good. So I just want to remind everyone that in addition to really funding research and the like, Fight CRC is really dedicated to convening groups and discussions like this. So again, that we can get a lot of the collective will, power, and resources to really advance our disease as it relates to research, as well as the eradication of colorectal cancer. And for our purposes, really talking about the impact for early age onset in young folks. So thank you so much. And just want to send a huge thanks for all of those who are engaged. And there are three of the advocates that are actually on the screen right now who've been very engaged in this work, and just want to say advocacy is a huge part of being able to drive this initiative, and that's something that Fight CRC has really led out as well. So next slide. So really what we're going to tackle today is Dr. Pereira will share some perspective during some discussion that he'll share based on etiology components of some of our subwork committee work. He'll have an opportunity to share more of his background perspective. And then Josh Dem is going to also be talking about symptomatology and research as well. And then Reese will be sharing a bit of the outcomes of our virtual summary meeting. So you'll get to hear from a couple different folks today who've been very engaged in the work groups, hearing about our last virtual summit in principle, and then really where we're going in terms of growing this international global consortium, and how we really are thinking about holding this group together to, again, really think about collective will and power around research and a number of public health and medical interventions, and around awareness and advocacy. And then we will be also talking a little bit about the opportunities for everyone to connect, to share information, to become abreast at the most current topics, and then how does that really inform your research initiatives and potential partnerships moving ahead, as well as ultimately, hopefully, having funders and other key thought leaders joining us in these discussions. So we'll talk a little bit about how we're moving the group ahead, and then planning again for the 2021 international meeting that was supposed to be held this summer in Spain, which we're aiming for next summer, with this idea that we'll continue to have an international collective joining in person every year, do in different parts of the world moving ahead, so that we can again keep this nice fabric of an international consortium moving in terms of thinking about how do we tackle early age onset. So we're going to be giving a bit of a deeper dive of what we've done and how we've got here. There was some requests from folks to understand what we've been working on, and that direction we're moving. So we'll go ahead and get started with jumping into the meat. So I want to just frame that back in 2019, a solid year and a half ago, Fight Colorectal Cancer devoted an entire day towards bringing in key thought leaders from throughout the country, as well as a handful of folks from international community as well, to talk about what can we do to really elevate the research agenda in terms of the common themes, areas that we needed to really study and research and prioritize. And this was also building off of the work that Tom Weber and his team in New York have hosted in terms of ongoing conferences talking about early age onset, some of the work that Tom championed with the National Colorectal Roundtable in terms of bringing in thought leaders, and then really kind of the trifecta of 2019 was having a dedicated research meeting that was held in Denver. And what was interesting at that time is that we brought in about 40 to 50 folks that were key leaders in terms of prevention, epidemiology, treatment, looking at different causation and etiology and understanding causation, folks who've worked in different disciplines to really understand what are, number one, the priority risk factors that we should be considering, identifying strategies and data repositories, and what are current cohorts or other types of means of study that we really could get at understanding risk factors and how to study them, prioritizing risk factors with the available opportunities for research, and then even thinking about how do we build new studies in the future for where there are gaps or where there are areas where we do not have current collective research or resources available. And a number of the things that we talked about at that Denver meeting were diet in childhood, antibiotic use in childhood, the interactions or even microbiome in isolation. How does obesity and weight change in childhood, especially with the obesity epidemic throughout the world, or throughout at least the United States happening? And then ultimately the gene and environment interactions, and how do these type of topics really play out in terms of understanding what might be happening in terms of understanding etiology and causation. So we spent a lot of time considering this work within a day meeting. I think it fostered a lot of great collaborations. We'll talk a little bit about the work that we did in terms of publishing moving forward. But one of the things that I want to talk about is that in terms of bringing together a group of about 50 people who were from multidisciplinary, interdisciplinary teams, we also then had a strong cry from the group to say, how do we hold this group together? How do we have someone really help really champion the cause of early age onset research and to help convene this work moving ahead? So this 2019 meeting was really, I think, from a research standpoint, an opportunity for us to really foster moving ahead. The Fight Colorectal Cancer team, as well as the board, really got behind convening this type of research work group moving ahead. And then, as I've spoke and mentioned, even with Dr. Pereira's work in Spain, Western Europe, the opportunity has now fused to really join efforts to really think about an international opportunity. So I really just want to say this 2019 meeting was great. It really did help convene some of the good interaction that had been happening already, and it built off of that work. And it gave us really kind of a home to continue the convening discussions and thinking about where we were going. So this is really where we started, the etiology, understanding causation. This was the topic for the day. Next slide. And as we continued, next slide, there we go. As we continued to really put this together, what happened from that day is around those big risk factors that I had spoke of. We really talked about the ways that we might study this work, different funding mechanisms, what were things that we needed to study really in isolation, and what really needed to be looked at in tandem at different time points through the life phase, as well as different geographies, understanding different backgrounds and the like. And we really did come up with a nice schematic of thinking about how we might really build studies, design studies, and think about the specific work. So this gave you a bit of an idea of really what came out of that meeting. Again, in terms of like thinking about some outcomes and some dedicated way that we really could approach research. And what I thought was also nice in terms of that convening and that networking, we really fostered teams that I think really have then further cultivated opportunities to work on definite research proposals that span different institutions as well as different countries, different parts of the country and the like. But this gives you an idea of some of the things that we were really considering for prioritization of research and how we would go about really considering this work. So again, thinking about the gene and environment exposure, thinking about factors like diet, weight, microbiome, antibiotic use, different time points in life, and then ultimately differences in race, ethnicity, geographies, as well as even stratifying further by MSI or MMR and MSI type status, and then thinking about further then ultimately the outcomes on incidence, as well as even thinking about advanced adenomas and thinking about what were our key indicators that we're considering when we're factoring. So I think one of the discussions that we'd had also is that we're not just looking at endpoint of mortality in some of the studies, but we are looking at incidence as CRC, as well as even advanced adenoma development as well. So these were the kind of discussions, the types of designs and ideas that were coming forward based on that meeting. Next slide. And really what was great about this is that in the end, we ended up being able to publish the outcomes of this study and this work, asking people to really consider that when they were really thinking about the types of research that could make impact, that they consider the types of factors, the type of consortiums, type of data components that were available that were elucidated at the meeting. And then ultimately, again, because these are a number of people that of course are respected in their field and have great background, publishing within gastroenterology that spring and really putting this meeting at the showcase was a huge opportunity for us to talk about early age onset as a phenomenon that we really needed to consider, but then what were strategies? And I think it was great that we were able to publish with all of the few people that you see in the bottom and really put something in the literature base about some opportunities for combined approaches and really thinking about networks and partnerships to move ahead. So ultimately, it's really, this group has now grown to over 65 global experts that had first started with us in terms of Denver. I think that group is actually now closer to 80 to 100 of folks that have really joined in to think about how can we really have some shared opportunity for education, research, and how do we really think about some collective work groups where we can really start to study some of the specific areas together. And one of the things that I want to say is really the impetus of bringing an early age onset working group together and convening is that we know that there's competition between research proposals, researchers. There's only limited amount of money, but what we do know though is also that if we have common metrics, common tools, and really think about some opportunities for networking and collaboration with research projects, we will go further together. So I would say that really the work that we put together in Denver, the work group that's convened, and even the work that you're going to hear about in terms of our work groups and activities is all on the precipice that all ships rise if we do good work together. And really we think about the commonalities, the way that we approach science in terms of looking at having common instruments, tools, a better way for patient recruitment, as well as further understanding a bit further about patient presentation, about how folks are really coming into medical care and receiving medical care, that if we do this work together, that we will be further ahead, even despite what are oftentimes very competitive funding cycles and limited resources. So we're really excited about moving this group moving ahead. And I think I also want to just say that on behalf of the organization being an education and advocacy group, the other part of the house with Fight CRC has been really engaged in the awareness components, advocating for early age onset, advocating for better resources for patients who are young in terms of those who are diagnosed, and making sure that ultimately that colorectal cancer is even on the radar for people when colorectal cancer has often been perceived as an older person's disease. So in the last year and a half, we've made great momentum, and one of those ideas, and we'll talk further about, was building toward the consortium in Spain, which ended up being a virtual meeting with over 500 folks being very engaged and registered for the meeting, and about 200 to 250 folks who remained active for that meeting just a few short weeks ago. So I'll have Reese and team will talk a little bit about what we covered that meeting, and then how that's building into the future work, as well as a consortium again that will be building in 2021 in Madrid, which will be a working meeting to again further our research. So, and Shalish, thank you so much for great work, team, because it has basically been a huge team approach. So next slide. When we came out of the Denver meeting, February 1st, in terms of really thinking about the work plan and the etiology, we had ultimately the prioritization of research considerations. We know different proposals that had come out of that, different networking opportunities. But in addition, I think ultimately what we heard is that causation and etiology is one type of research. When we think about practice-based research really around prevention and symptomatology, that was an area that we needed to concentrate, as well as thinking about the clinical and public health perspective. So if you look at priority of activities coming out of February 1st, etiology has a lot of activity around off to the left, which we'll speak about, but right in the middle you see more work that needs to really be done from the clinical and public health practice, as well as work that's now blossoming under the leadership of Josh Dem and Samir Gupta, and then further work around developing a repository and common metrics that actually needs to be updated, because that's really with the leadership of Dr. Perea and Heather Hempel and their team. So we'll talk a little bit further about that as well. But I think one of the things that we heard loud and clear is causation and etiology is one area, but we really need to think holistically about what this group can continue to tackle. So if you really look at, again, the results that came out of February 1st off to the right, we were published in Gastro in terms of really sharing the results of the meeting. Jeff Lee, Dr. Corley were really emphatic that we needed to put this out in the peer review literature. It's been cited many times to think about approaches for study and causation, and really thinking about resources and how do we build upon what's available and what needs to be built further. The work group started to form. When we started really going through a process of understanding the priority of activities from February 1st, we were also able to publish that work in gastroenterology, where we talked about the build out of these three areas. And then that led to the prioritization and the work groups that are here listed. And so what I should say that in addition to really forming these groups, that we've been able through Fight CRC to garner resources for coordination of the meetings, resources for leading this out, and then helping through a number of the investigators and folks who are involved, building off the resources they have available to really help find a common center to do some great work. So Josh and Jose are going to talk a little bit about that as well. But what I also want to show is off to the left, if you really think from February 1st to even now and the formation of this etiology work group, in that time we'd had the ear of the NCI, who's very interested in early age onset and was very excited about the outcomes. They attended our February 1st meeting. CDC was very engaged as well, and others, even DOD, hearing and thinking about how we were tackling this, that we were coming up with real plans. Folks were really ignited and excited about this work. For those of you who have followed the NCI funding, which I'm guessing many of you have, of course, the provocative research question included early age onset this last year. NCI helped us think about their current funding portfolio and how do we match early age onset funding initiatives to the work that investigators who are part of the group to help think about ways to help move the type of research we talked about February 1st to really come to play. And then the DOD really has done a great job of also really talking about what are the opportunities for their funding cycles, and have presented to the group and have been engaged in our calls thinking about where we're moving. The NCI is, I think, exploring different opportunities for further research meetings, think tanks to help move us ahead as well. And then as we're starting to see, international cohorts are starting to begin to form out of this etiology work group. So we do know there are several investigators who've actually joined together as a result of February 1st and these ongoing discussions to think about how do they cross-pollinate and build stronger research proposals together. So again, I think out of anything that I probably worked on in my research and public health career, this is probably one of the things that I've seen work most fast or efficiently, as well as actually seen the most traction in a short amount of time. So I'm really proud of this work on behalf of Fight CRC, and just can't say enough about all of the 65 to now almost 100 people who've been involved in this work. So we are going to talk about what are the priority activities, what's happening with each one of these work groups to give a flavor of part of the things that have been happening. We're going to talk a little bit about means and ways that people can be engaged. But I think a lot of the buildup that we're going to be speaking about in this next year is also how do we build on some of the topics that Dr. Perea will share about further to do some cross-pollination to really help inform the sub-work group activities, but then again, building to this whole idea of elevating research. What are some of the topics people might have questions on, need to hear from key leaders, have their specific ideas really vetted through some opportunities, and again, thinking about further partnerships moving ahead. So we'll talk a little bit about that as well. So this just gives you a bit of a roadmap of what we've been able to accomplish so far. I'm going to just say a quick few words because I've been talking a lot. That while we have Dr. Perea and Josh speaking about their respective areas in terms of the work group activities and what they've been working upon, one of the areas that we are really trying to grow further is the public health and clinical implications of awareness and outreach. And part of that is really thinking about collaborations with the NCCRT and their family history work group and some of the initiatives they're working on as well, to think about how do we look at uptake of understanding of high risk genetic syndromes and abnormalities. What do we look on the forefront for providing more education? And how do we really look at public health and clinical interventions to identify folks who might be at risk for colorectal cancer? So that's been one of the big things that conceptually we've been working on. We've been a little slower. We had some of our plans ready to roll and then COVID hit. But this is an area that we're really continuing to explore and really thinking about the partnership with NCCRT and how do we move that along. So I'm really excited about where we're going. Again, thank you for all the people who've devoted time, energy, and hours. And I think a lot of the folks who put a lot of good faith in this process. I think the fact that NCI, DOD, and NCDC have been around the table, as well as other thought partners, and that we're now starting to really button up more international collaboration says a lot about the faith that people have in this group and really the seriousness of the disease of which we're tackling. So I'll go ahead and go to the next slide. And I think I'm going to punt to Josh Dim. So Josh, if you could give us a quick introduction of who you are and walk us through the work of the symptomatology research group, that would be fantastic.
Thank you, Andy, for that awesome introduction. It's really cool to see just the big picture of what's going on with Fight CRC. So just to give you a breakdown of one of the smaller groups, my name is Joshua Dem. I am a epidemiology postdoctoral researcher at University of California, San Diego, and the San Diego VA healthcare system. And I have had the great opportunity of joining Fight CRC in this work to expand upon early age onset colorectal cancer research. The group that I'm going to talk to you about is something that sort of came about as part of that large working group meeting in 2019, but also something that's sort of been building in the background. And as I'm going to get to in just a little bit, part of the reason why this came about is because of the evidence that exists that shows that there is this concern about the symptomatology component and how presentation might be a concern and something we need to think about as we are trying to detect early age onset colorectal cancer cases earlier. and how we might address that and how we might build on that to create more pointed interventions to ensure that we are detecting early age onset colorectal cancer at the earliest point and in an efficient manner. So the Symptomatology Research Group is a collaboration of a lot of enthusiastic researchers who are really trying to get an angle on not just the question of cause and effect, but also when symptoms start to arise and when signs are starting to indicate that that an individual might have early age onset colorectal cancer. Next slide. And as I said, the genesis of this really came from the evidence that existed when we were thinking about this. 70% of early age onset colorectal cancer cases are likely detected as a result of signs or symptoms that might signal its presence. And the reason why this is a bit concerning, other than the fact that it's not coming as a result of screening necessarily, is that between the time from initial presentation to an early age onset colorectal cancer diagnosis, there's concerns that potentially long delays might occur. And in studies that have tried to look at this, the average time to diagnosis has been about 6 months. And it's very unclear at this point. There are multiple thoughts as to what this might be attributable to. Some think it's variation in practice patterns for referral to rule out colorectal cancer. Some think that it's a lack of awareness or strength of evidence linking signs and symptoms to early age onset colorectal cancer. The thought process being, are we looking at GI symptoms specifically, or particular signs that might be much more non-specific that might actually be very big red flags that we need to be thinking about? And then sort of the last step, and this goes to what's been building up over the last few years, what with the American Cancer Society expanding screening to a younger, or recommending to expand screening to a younger population, but then also thinking about further and what that means, expanding the potential number of people who might be exposed to sort of colorectal cancer screening or diagnostic tools. Is that there tends to be a lack of clear guidelines where signs and symptoms merit colorectal cancer workup, and that's particular to that younger population. Next slide. And so, at least at the outset of our group, there have been 3 key questions that we've been thinking about. The first one is, among adults diagnosed with early age onset colorectal cancer, what are the most common presenting signs and symptoms at diagnosis? Very much the goal here is to get an idea of the landscape of what we're seeing when individuals present with early age onset colorectal cancer. And going back to that idea of, are these very specific GI symptoms similar to what might be a presentation in someone who's over 50? Or are we looking at non-specific symptoms that tend to cluster within the a younger than 50 group? And this sort of builds into the next question, which is, among those adults ages 18 to 49, what is the strength of association between the signs and symptoms and risk for early age onset colorectal cancer? Once we have an idea of what the symptoms are, how are they associated with early age onset colorectal cancer? Are there major signs that we need to be looking for that might inform clinical practice in a more pointed way than what we are doing in adults over 50 or 50 and older? And then sort of to that last point, as we think about delays and the potential concerns that come with delays, among individuals diagnosed with early age onset colorectal cancer who present with signs and symptoms at diagnosis, what was the average time to diagnosis, excuse me, from systematic presentation and its relative impact, if any, on early age onset colorectal cancer outcomes, such as stage at diagnosis? Thinking forward from this time to diagnosis question and that sort of window of time, does that affect outcomes where it leads to potentially a later stage of detection? And with the ability of being able to think prospectively about potential research that can move forward, how does it affect long-term outcomes? And so these are at the outset the 3 questions that we've thought about. Next slide. Thank you. And we thought that the best way to address this, at least at the start of this collaborative group, was to conduct a systematic review meta-analysis to examine these 3 questions. So currently we have a team of about 16 researchers who are working together to address these three questions in parallel. And to do that, we've developed three different teams that have all broken up to focus on a specific question that was of particular interest to them. And the goal from this is to sort of focus everyone specifically in an area for when we get to a literature review phase. And we are currently preparing for that by developing key search terms and sort of thinking through what are the studies that currently exist and what are other additional studies that we need to dig into to make a very comprehensive systematic review meta-analysis that really gets an idea of not only the landscape of the current knowledge that exists in this area, but more importantly, where the gaps are. And so I'm thrilled to be a part of this group. It's been wonderfully collaborative, and everyone has had such great enthusiasm. So it's been an absolute pleasure to be a part of this group. And if anyone has any questions, I'm happy to answer them. Otherwise, I turn it back to Andy.
Awesome. Thanks, Josh. And I know part of the question that the groups have been considering right now is in if and when there might need to be some additional inclusion of folks. So that's something that will provide updates after this initial, the initial steps of these groups moving out, and could be a way to get engaged. So we'll provide some great updates as we continue this work, and really appreciate the leadership of Josh and then several of the team members who've been really leading out these specific areas. Can't thank you enough for all of the great work, and super excited about the contributions. So that sounds great. So we'll go ahead and go into our next slide, and I am going to turn it over to Dr. Perea to talk specifically about the etiology work group and the pieces that we've been moving forward, in addition to creating that lovely work plan around research initiatives, priorities, and what was published in Gastro, then some additional work that the etiology work group has taken on. So Jose?
So thank you, Andy. First of all, I would like to thank Fight Colorectal Cancer with about this effort, and of course for inviting me to be part of this important initiative regarding early onset colorectal cancer. So specifically about one of the projects that we are now developing since maybe 2 or 3 months ago is focused specifically in sporadic early onset colorectal cancer. So as you all know, more or less than 80% of early onset colorectal cancer are sporadic. So maybe in the theology of that part of the early onset colorectal cancer should be involved environmental factors. So there are a lot of multiple prospective studies nowadays currently focusing on sporadic early onset, and most of them are designing studies or questionnaires regarding environmental exposure. So those questionnaires are trying to ask patients what about lifestyles, habits, and all of that involved in the possible development of early onset colorectal cancer. Next slide. So we started, as I have told, 2 or 3 months ago. This is the team. Heather Hampel, Caitlin Murphy, and I are trying to fix 3 different questionnaires, and of course Andy and Reese are collaborating as well. So we are trying to put in common to make put together 3 types of questionnaires that are being developed in 3 different studies nowadays. One of those from Heather Hampel from Ohio, then another one from Caitlin Murphy from Texas, and then one of our questionnaire that has been developed here in our European prospective study. So these are 3 different questionnaires, and we are trying to put in common all of them, trying to fix in one common questionnaire that could cover all the aspects regarding environmental aspects for early onset colorectal cancer. Please, next slide, please. So these are the topics that has been developed in those 3 questionnaires. So the topics are demographic, races, gender, and all types regarding that. Then we have personal medical history, not only cancer history, but also hypertension, diabetes, and so on. we have a lot of questions regarding medications, supplemental intakes, then of course different habits about smoking, alcohol, etc. Then another one that is important regarding colorectal cancer as a whole and particularly early onset is physical activity. Then dietary intake, a lot of questions regarding type of food, the frequency and so on. Then we have three different topics regarding reproductive history in the way that female patients of early onset colorectal cancer, and then some aspects regarding colorectal cancer history, and then familial history from those different topics about cancer and not cancer history of those patients. So those are the topics that are being put in common in one questionnaire. And then next slide. The idea is not only to put them in common, but also the next step is also to differentiate some theaters according to the geographical locations, because we think that maybe if some people from different countries and different continents could use our tentative questionnaires, maybe should be differences specifically in races, or maybe in the dietary intakes or something like that. So we are trying to fix that differentiations. And then when we put together all the questionnaires in one, the idea is to share that final tentative questionnaire to the working group, just to see what are the opinion about that, possible suggestions, possible changes. And finally, another point that we find that it should be interesting is just to validate it in some Fight Colorectal Cancer members, just to see if it's easy to fulfill, it's feasible to make it complete, and something related with that. So this is the idea. This is one of the goals of the etiology aspect of the project, and now we are working. Finally, I think maybe in this month we are going to get the common questionnaire to share with the group, and then think, what do you think about that?
Awesome. Thanks so much, Jose. Reese, if we want to go back just to the quick slide, one of the things I want to highlight too, and I think as Jose said, I think it's going to be critical that once we have the first vetting of the metrics and thinking about this validation, or really sharing with the group, we are going to need teams to really share back in terms of probably another review, really giving feedback about where we've landed. You know, some of the instruments and some of the tools that Jose had mentioned are validated. Some are actually areas where they could use additional validation techniques, and that's where we talked about maybe using the Fight CRC advocates and survivors and folks who come to help look at possible validation and reviewing tools and instruments, so that we could put that within you know, the cadre of types of tools and instruments that are put forth in terms of us all using the kind of questionnaires, the kind of metrics to make sure that when we do research, that it's apples to apples, and that there's really a repository for people to come forward. But Jose, I think as you mentioned, you know, there are going to be additional opportunities for people to really review this information and so again, as an opportunity to become engaged in both the work that Josh spoke of forthcoming, there's some likely opportunities, as well as in this opportunity with this work group, definitely some room for either people who haven't been engaged in the work groups or would like to be engaged in these, you know, reach out. We'd like to have you really invested in the work we're doing moving forward. Reese will share a little bit that if you haven't been engaged in the early age onset work group and you're interested, how to do that, and then also how to capture how you might like to be involved and engaged in this work. And I think Dr. Shroy is on the line today. We will be continuing to also think from the public health and looking at the family history work that NCCRT and others are doing. How do we really look at combining forces and using the tools, instruments, and resources that have been developed? How do we look at stronger connections around awareness as well as provider awareness and provider practice. How do we really dig in to do something about the things that we do know can be done in terms of family history, genetics, and understanding signs and symptoms as well. So we're really proud of this work. We're excited about what's been done, again, in a short period of time, and there are ways to get engaged. So Jose, anything else before we transition next to having Reese share a little bit about the consortium meeting that we hosted a couple weeks ago? Josh or Jose, anything else?
No, for me that's it.
You're good to go? Okay.
Same here.
Okay, sounds great. All right, Reese, we'll transition on.
Awesome. Well, thanks, Andy. Hi, everyone. My name is Reese Garcia. I'm the Research Advocacy Manager at Fight Colorectal Cancer. Before Jose and Andy dive into next steps and the working plan going forward for the Early Age Onset Working Group, we wanted to spend a few minutes highlighting some highlights from the 2020 Early Age Onset International Symposium that was hosted on June 11th. And so if you haven't watched it afterwards or you weren't able to join us live, it is hosted on the Fight CRC website, and I'm happy to drop that link in the chat function in just a moment. Throughout the day, it was really amazing. We had 427 attendees and panelists in attendance, and that doesn't account for the 250 individuals that stayed on for the full 3 hours as we really worked through the topics. At the end of the day, we had 17 countries represented, with almost nearly every continent covered. And throughout the day, we covered topics including the worldwide trends of early age onset. So Becky Siegel gave a great overview of those current worldwide trends, followed by a presentation from Heather Hampel on the hereditary and familial components. Jose gave a great overview of the molecular approaches. I spent some time covering the patient's perspective of early age onset colorectal cancer. Dr. Antonino Spinelli from Spain also discussed implications of COVID-19 on early age onset. And then Dr. Richard Hayes finished us up with genetic and environmental risk factors. So we had a really great gamut of topics, and throughout the whole presentation, there was a emphasis on the need for research efforts to be collaborative, global, and integrated. And throughout the symposium, there was also a need for increased diversity among study populations, including racial, ethnic diversity, geographic diversity, and just a diversity of disciplines and roles in general throughout this working group. And then finally, Andy ended us with discussing next steps for the early age onset, which, like I mentioned, will go in to a little depth today, which also includes creating a worldwide network, engaging clinicians across the world, researchers, patients, and families, and then really updating the knowledge through different learning opportunities and creating these cross-cutting collaborations. And then just on a final note, we are currently working on a formal report to follow that will summarize the meeting, but also prioritize concrete next steps. So I'll hand it back to you, Andy.
Okay, this is great. So one of the things that we had talked about is that as we really looked at that 400 to 500 people who were really coming from those 20-ish countries, and if we want to continue to build this real strong fabric of an international consortium, I think with the leadership of Jose and with Fight CRC, we are now, what you'll see moving forward is a new logo. We're going to be working on a combined strategy to think about how to really pull people into the work. As you can imagine, 500 people to hopefully maybe even 1,000 this time next year really engaged in this discussion and thinking about collaboration and the like. We want to have opportunities for everyone to be engaged. So the work group activities have blossomed nicely. There's a number of people engaged. There's going to be additional opportunities to engage in that work. But in addition, we wanted to create a forum for some learning opportunities. So Jose is going to talk a little bit about the topics that we're considering moving ahead. But for the next year, we are considering basically an every other month type of approach where we will spend a dedicated time for 1.5 hours to 2 hours where we will have presentations around a specific topic that's very relevant to early age onset research. We will have panelists involved in some of the discussion areas. We'll have questions ahead of time, and we'll use these as really an opportunity and workshops for people to really hear about a topic, put their questions ahead to the key subject matter experts ahead of time, think about how they would work them in the research proposals and the like. And what we've considered is using about maybe 6 different topics over the next year to really delve into as a place where people can learn, convene, make connections. So we want to create a worldwide network. Yes, we want to rule the world. I didn't put that in there, but that's what the worldwide network is on some level. But as it relates to early age onset colorectal cancer, I think as Becky Siegel and others have noted, it is really a global trend, especially in developing countries. So we do need to think about how do we build research studies and collaborations that do go across oceans to different continents, so we can really get the size of studies that we need to really move the work ahead. So this approach is really thinking about an every other month webinar workshop where we do discuss specific topics. We delve into Q&A type component and really help build into the proposals and the research base that you're all considering. The other thing that we will be doing is then building out through the Fight CRC website our specific researcher profiles, where there will be a portal where if you want to make connections with specific researchers who are part of this work, hear their work, see what they're doing, their latest publications, their research interest, we can start creating a forum where people can start to better connect. In addition to these live events, such as what Jose will be talking about with the International In-Person Consortium, as well as these webinars. And then as time continues, I think we'd like to be able to create some sort of situation too, that as we start to see people really talking about their specific research area or interest, that we can start also showing these kind of trends so people can, in addition to organically connecting, we can find technologies to help us make sure that everybody bumps into each other through these opportunities through this work group. So again, I think it's amazing. You know, we're 500 large, basically attending virtually. We have a lot of opportunities virtually. We have opportunities in person. Fight CRC is committed to putting resources into this area to move it ahead. And then Dr. Perea and his team, and we're hoping as others really start to draw into this area, we can continue to have resources and build even a strong consortium moving ahead. So these are some of our early plans. And then I'm going to punt to Jose to talk a little bit about some of the topics that we are considering at this time as we build out this webinar workshop series in the coming year.
So thank you, Andy. So these are the tentative topics. This is important to know because this is not closed, this is not definitive. So it is important that members of the work group can suggest another topics that could be of interest. So try to fix them in the previous topic on make a new one. So these are the one that we at the first sight we have think about. For example, one of them should be about clinical and diagnosis regarding the signs and symptoms for appearance of early onset colorectal cancer. That is focused maybe on just work and study group. Then maybe another one should be risk factors regarding environmental, maybe familial factors. Then another interesting point, I don't know if you all know that I'm a surgeon, but I think it's very important, the differences regarding surgery for early onset colorectal cancer, not only for hereditary forms, but also specifically for young patients about psychological impact and so on. So I think this topic could be of a very interesting one. Then, of course, the proportion of susceptibility genes, the 20% that are hereditary forms. Another one could be the new approaches about liquid biopsy, maybe mRNA profiles about early diagnosis, or maybe the diagnosis of recurrence. Then another one should be of interest, all the topics or all the issues regarding surveillance from the hereditary forms, but also the sporadic ones. Then, as Andy has told in the previous slide, it's important to know the studies that are being developing at this moment around the world are currently starting. Maybe not only the projects, but also the important works that are being published in different journals. So maybe not in one specific webinar could be could be developed, but also in all of them in 5 or 10 minutes to make a state of the art or an update of the study that are being published in that moment, and then of course environmental interaction. So the idea is these are the first tentative topics, but all of you can suggest another one just to before making a definitive list to develop more or less six, 7 webinars until the June of next year. That would be the 3rd edition of this Early Onset International Symposium. Another thing, or another idea is that the date should be maybe the first Tuesday every other month, every 2 months. So we are thinking about that, but I think it's important for everyone that the date should be the same for all the webinars, just to not forget. And of course, we should have enough time for discussion. But because I think that point is the important one, just to move ahead and move forward in the evolution of the research of early onset colorectal cancer. So Andy.
So, and I want to say that I think that during the course of the meeting, the consortium and the meeting that we hosted a couple weeks back with Jose's leadership as well, is that the fury of questions and the side discussions and the questions that were coming in, I think that there's really great fodder for hosting topical areas, as Jose mentioned, and talking about moving this ahead. So that the Zoom feature gives us a lot of great advantage for chatting, for small group work, for opportunities to really delve in. So we were really excited to see about the amount of energy and questions and opportunities for collaboration. So we're really going to capitalize on that and build that out over the next year. So speaking of building it out, we're right now in the 0 to 3 month phase. So we're kind of in a bit of an infancy slash, young, I don't even know all the, I'm not even going to try to get into infancy, toddler, or whatever, I will lose track. But we are just starting to really build this infrastructure out based on the success and the work we've had. We're going to be building out profiles of new and existing work group members. So Reese is going to share a little bit about how to get connected into that. Fight CRC, working with Jose, we'll be building out specifically these webinars as we spoke about. And then we're providing the overview of the subcommittee work groups that we've shared today, and we'll continue to build out that work and talk about opportunities. So that's where we are right now. We will be having some dedicated look and feel for this group as research opportunities become available, funding resource. We also plan to really have funders and others come to the table to share like we have as well. So we're building this out. There's a lot of underwriting right now in support for this work. We're really excited about moving this ahead. In the next 3 to 6 months, this live portal will come out. And so I think Shalish and others have mentioned different types of portals and opportunities that we could build in technology to help make the connections, networking opportunities, funding opportunities, sharing the information, and we'll ultimately begin these webinar series. Actually, this month, we're just getting kicked off to give background for those of you who are new. And then actually starting in August, or wait a minute, we're July and September, we'll start the webinar series to get this kicked off in terms of this workshop type component. And then we're going to continue on in the next year, these ongoing activities, but in the next 3 to 6 months, we are also going to start actively talking about the planning of the meeting in Madrid. And I think we're going to really be in consideration of thinking about topical work. I think we will probably also consider how do we do work like we did in Denver that is very functional, very topic driven, with having some outcomes to think about how do we really progress this work. And a number of the things that have, I think, been considered in fundamental theory or design, maybe how do we bring that work to action. So we're starting conversations with funders, with the federal agencies about this meeting coming forward. How does it build into their work as well? But we're really going to need all of you around the table to help us really think about these webinar series, as well as what we're building coming into the meeting in Europe, and how do they all really gel. So a lot of good work. We really thank the board of directors of Fight CRC, as well as the teams that Jose is leading out, for again giving the resources and energy and time into work moving this forward. But I think again, the proof is in the pudding that there's hundreds of people attending and a lot of resources already donated to this work. So you can't deny the energy and enthusiasm. So we're going to continue to build upon that as well. So stay with us, stay on. The more we can get you integrated into this work, the better. So we'll go ahead and go to the next slide. And I think we're going to talk a little bit further about the International Symposium. And I've set that up a bit, but Jose, would you like to share some more about what we're planning out?
Yes, yeah. Just to add that, to culminate all the efforts that I think we are going to make the following year, it's planned to be the third international symposium of early onset colorectal cancer, hopefully in Madrid in person. That would be in June. The idea is to be during 2 days. We are planning to make it not only in person, but also in streaming. Just to connect all the continents that are interested in early onset colorectal cancer. Of course, we are going to plan an abstract sessions just to present all the works that are being developed about early onset colorectal cancer, and the idea about all this international effort is not only to be hosted here in Madrid, Spain, but also we don't know, maybe we are going to put one in Europe, one in the United States. We should think about that, but the idea is to alternate the continents of this event, just to make all the people, all the members of the working group, and all the members that are interested on early onset colorectal cancer to participate in this event. So this is the idea. All of you, of course, are invited. And we are planning to have the definitive dates in the next few days or few weeks, just to send it to you, just to start planning the event. And of course, all of you are invited to make suggestions about the topics, the items, everything you want to have in that symposium. Everything is very welcome, just to make it better.
Wonderful. So we're very excited about this, and again, a huge dynamic opportunity, and I'm very excited about perhaps this idea of the in-person and the streaming, and I think with some of our meeting designers and tech gurus, we can really figure out how to pull this off. And I think one of the things we're really interested in is I think that there are a lot of great conferences and people who are imparting good information and the like. I think these meetings that we're hosting are also really considering taking the research agendas as well and really progressing them, and how does that fit with more publications, more research proposals, abstract discussions, and really thinking about the elevation of the science. So I do think there's a lot of great folks who've been doing a lot of work in the advocacy realm, in general information sharing as well, and have built some solid foundations. So I want to give them a huge shout out to a number of the groups and orgs, and we're going to try to continue to think about collaborations. But I do think that with the work we're talking about, we're really considering about the elevation of the research agenda. So next slide here. I just wanted to thank Josh, Jose, Reese, in terms of sharing, as well as the other folks who've been very engaged in this work. Some of you who I see are new to this work or haven't had an update, thanks so much for being involved. And then in terms of getting involved and staying involved, Reese, do you want to share about how this is working right now?
Yeah, absolutely. So if you all are new to the group and are interested in pursuing these learning opportunities and being part of the webinars and really building out this consortium that Andy and Jose spent some time talking about, I have put a link in the chat for a quick survey. It won't take more than 5 minutes of your time, but it really helps us get a good pulse check of who's interested in joining this international consortium of like-minded researchers, patient advocates, providers, and so forth. So again, if you're new to the group and you'd really like to be part of this work, please fill out that survey as soon as you can. And we look forward to working with you all in the future as well.
Okay, everybody. I don't see any other questions. I'm going to give a moment for anyone to come off mute. I didn't see any as we were presenting, but I do want to just give a second or two that if there are questions for people to come off mute. And the mute is on the left-hand side. If you toggle down, there's an X through the microphone. Means you can't talk, but if you hit that, you can unmute. Okay. I hope Shalish has finished his grocery shopping. I think he was at the market while he was doing the multitasking, which I think we all have probably mastered by now. And a huge thanks again to Dr. Preya for all of this work, and we look forward to really moving forward. So have a great day, everybody, and thanks so much for your time.